Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 6 Common types of allergies. Allergies are the sixth leading cause of chronic illness in the United States. It is estimated that over 50 million Americans are affected by some type of allergy. This condition causes the immune system to react or overreact to a foreign substance called an allergen. /r/n/r/n Many foreign substances can trigger an allergic reaction, ranging from foods, medications, pets, and airborne particles inhaled through the lungs. /r/n/r/n Depending on the allergy type and the severity of the reaction, the symptoms can vary from mild, coughing, itchy eyes, a scratchy throat, sneezing, hives, and a runny nose, to severe and at times life-threatening, triggering an asthma attack, trouble breathing, low blood pressure and even death. /r/n/r/nVerywell, Sydney Saporitornrn Because reactions can be dangerous, it is important to know your triggers, and your loved ones, and recognize and respond to symptoms as necessary. /r/n/r/n This article will review common types of allergens, the associated symptoms, and strategies for managing allergies. /r/n/r/nMladenbalinovac, E+, Getty Imagesrnrn Allergies are essentially a malfunction of the immune system. Most allergies are thought to be influenced by genetics. Children usually inherit a tendency to develop allergies from their parents, not an allergy to a specific allergen. /r/n/r/n Some of the common types of triggers of allergies include the following. /r/n/r/n Any food can be an allergen. Depending on the food and the response of the body, the reaction may be classified as a food sensitivity or intolerance rather than an allergy. For instance, lactose intolerance is an inability to digest the lactose in milk rather than an allergy. /r/n/r/n Symptoms of a food allergy may include itching, hives, nausea, vomiting, diarrhea, difficulty breathing, syncope, feeling like you are going to pass out, and anaphylaxis. These symptoms can be life-threatening. /r/n/r/n The most common food allergies are the following. /r/n/r/n True drug allergies are fairly rare. What many people think of as a drug allergy is actually an adverse reaction to a drug. /r/n/r/n In a drug allergy, immune compounds called immunoglobulin E, IgE, antibodies react to the drug. Since the drug circulates through the whole body, it can cause allergy symptoms through the body. Symptoms may include hives, wheezing, shortness of breath, throat and mouth swelling, vomiting, diarrhea, or fainting. /r/n/r/n If it's suspected that you may have a drug allergy, an allergist can perform certain skin tests and/or medically supervised drug challenges to help determine whether you are truly allergic. /r/n/r/n While penicillin is a common drug allergy, more than 9 out of 10 people who think they have a penicillin allergy and are tested do not have the allergy. Drug allergy testing should only be done in a medical setting where adequate expertise and treatment are available to manage anaphylaxis. /r/n/r/n Latex is found in natural rubber products made from the sap of the Brazilian rubber tree. An allergic reaction can occur from both coming in physical contact with a latex product or from breathing in latex powder. /r/n/r/n Some products that contain latex include the following. /r/n/r/n Symptoms of a latex allergy typically include swelling, itching, and redness after coming into contact with latex. If you are highly allergic, it's possible to have a more severe reaction to contact or even from a small amount of latex in the air. /r/n/r/n Synthetic latex doesn't trigger the same reaction, so it's generally safe for those with a latex allergy to use. /r/n/r/n It's normal to have a localized reaction, like itching, swelling, redness, or discoloration where the bite or sting occurred, but some people have an outsized reaction to the bites. /r/n/r/n stinging insects like bees, wasps, fire ants, hornets, and yellow jackets are most likely to cause an allergic reaction, and reactions can be severe. If you do have an allergic reaction, it can be life-threatening, so it's important to seek medical attention right away. /r/n/r/n early symptoms may include the following. /r/n/r/n The most common allergy triggers are tiny particles found in indoor and outdoor air. When these particles are breathed in, they can cause inflammation and swelling of the nasal passageways and the delicate tissue around eyes. This, in turn, causes symptoms commonly associated with allergies, such as itchy, watery eyes, congestion, runny nose, and sneezing. /r/n/r/n Common airborne allergens include /r/n/r/n Skin allergies are more common in people with sensitive skin and skin conditions like eczema. An allergic reaction may be triggered by chemicals in skincare products, detergents, and soaps, as well as contact with plants such as poison ivy, poison oak, and poison sumac. Symptoms may include hives, inflammation, rash, and formation of dry, itchy patches. /r/n/r/n If you have known allergies, it is important to work with your healthcare provider to create a plan for managing your reactions. /r/n/r/n If you suspect you have allergies, you can also talk with a healthcare provider about getting tested to confirm your triggers. If you have environmental allergies, you may also be able to work with your allergist to create a treatment protocol, for example allergy shots, for your allergies. /r/n/r/n In addition, there are other ways that you can keep your allergies under control. /r/n/r/n Remember, if you feel an extreme allergic reaction coming on, it is important to call 911 right away and wait for help to arrive. Driving yourself or someone who is having a severe reaction to the hospital may do more harm than good if you don't have the proper equipment to help them on the way. /r/n/r/n An allergy is a malfunction of the immune system where the body overreacts to a foreign compound called an allergen. Food, medications, latex, insects, airborne compounds, and contact allergens. It's important to know your allergy triggers, especially if you experience severe reactions, so you can avoid them when possible and know when to seek emergency medical care if you have a life-threatening reaction. /r/n/r/n If you have allergies, know that you are not alone. There are treatments available to help manage your symptoms. However, it's also important to understand your allergy triggers and your body's response to know if and when you are having a dangerous reaction and can seek help immediately. /r/n/r/n Living with a severe allergy can be scary, but your healthcare team can point you towards resources and additional tools to help you navigate life with an allergy and stay safe and healthy. /r/n/r/n Airborne allergens found in your environment are the most common type of allergen. Other types include food allergies, drug allergies, latex allergies, insect allergies, and contact allergies. /r/n/r/n Penicillin and related antibiotics are the most common drug allergy triggers. Other drugs that may cause reactions include antibiotics containing sulfonamides, sulfur drugs, anticonvulsants, aspirin, nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen, and chemotherapy drugs. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.